guys, welcome back to our channel. It's Veronica, 2 Ferns and a Candle. Today we're going to be going over the criteria for heart failure. So we're going to be going through New York Heart Association as well as the American Heart Association. So I'm going to start off with the WHO New York Heart Association criteria. So this has 1, 2, 3, and 4 different levels. So the first level is going to be no symptoms, no limitations with ordinary physical activity. So that's somebody who exercises daily, goes to yoga daily, and they have no problems doing that, which is something that they do ordinarily. The next one is level 2, so you have mild symptoms and slight limitations with ordinary activities. So again, ordinary activity is something where it's something that you typically do on a daily basis, so like going to the gym, yoga, going for walks or hikes. And so, slight limitations, but you're still capable of doing them. And then number 3 is marked limitations due to symptoms. So less than ordinary activity. So this is where we really need to be able to distinguish that, where less than ordinary is something such as like going to get water in your kitchen or going out to get the mail. So this is something that you should be able to do. But the thing is that they're fine at rest. So going down to level 4, this is severe limitation. So they have symptoms while at rest. So rest does not help. So I know some people kind of get tripped up between 2 and 3. So you just really want to make sure you differentiate ordinary symptoms and less than ordinary symptoms. Less than ordinary are things that people should be able to do regardless. So we're going to go ahead and move on to the American Heart Association with Shannon.
Hey guys, this is Shannon. So we are talking about the American Heart Association heart failure classifications. The reason we have 2 different systems, no one knows, but I am going to tell you a way to keep them differentiated in your mind forever because they are very confusing to mix up. So you can remember that AHA is A, B, C, D by remembering AHA, A, B, C, D, whereas New York is 1 through 4. So this is letters, AHA is letters. Another way, I'm going to go through them, then I'll say. So A, you are asymptomatic and no structural heart disease. B, you are also asymptomatic, but you are positive for structural heart disease, which is seen in the echo. C, you are symptomatic and you have the structural heart disease. And then D is refractory heart failure, so that means it's not responding to treatment. So sometimes I get this mixed up that A and B are both asymptomatic because in New York, 1, you're asymptomatic, but then 2, you are symptomatic. So the way to remember that in AHA, you're asymptomatic in both A and B is that there's an A here and an A here. So AHA, remember asymptomatic, H, asymptomatic, because the first 2 classifications are asymptomatic. So I hope this helped. Hopefully you can remember that, and that will help you remember the rest of your life. And then hopefully you'll remember that the New York 2 to 3 is like whatever gets confused on 2, the ordinary, and then 3 is less than ordinary. So thank you for tuning in.